Welcome to our thyroid video. We are going to discuss the 6 patterns of thyroid dysfunction and natural solutions to supporting your thyroid. You see, many people come to me with lack of energy, brain fog, digestive issues, hair loss, weight gain. And if you are like most of my patients, they've tried a lot of things in an effort to get their energy back. What I've found over the years is what they really want are the answers to 2 basic questions. Why do I have this condition, and what can be done to get my health back? The answer, which I will explain to you in this webinar, is basically there is no single magic potion or pill that will help you regain your life. It is a process that begins with identifying the underlying cause rather than just treat the symptoms. Let me introduce myself. I'm Dr. Michael Veselak. I'm a board-certified chiropractic physician, board-certified in Integrative Medicine, and a certified functional medicine practitioner. A few years back, I discovered a few concepts that I want to share with you that literally changed my life. So if you're frustrated and you want to really feel good, listen carefully to this next part, because it is the most important part. It is what your doctors fail to tell you why you have the thyroid issue. And that is, all chronic health conditions have some common threads. There has to be an underlying component such as gut dysfunction, adrenal imbalance, detoxification issues, infection, viral, bacterial, or parasitic, toxicity, chemical or heavy metal, a nutrition deficiency, to name a few. This imbalance will cause a decreased firing of the brain and nervous system as fatigue and perhaps degeneration sets in. In our office, we see a combination of neurologic and metabolic problems, and the ratio is different for everyone. So let's talk about the thyroid. Some symptoms of thyroid dysfunction include fatigue, weight gain, depression, constipation, sensitive to cold weather, dry itchy skin, brittle hair, the hair falls out easily, the loss of the outside portion of your eyebrow, poor circulation and numbness in the hands and the feet. The thyroid is extremely important. It supports bone metabolism, the immune system, the brain and nervous system, the endocrine system, gastrointestinal system, liver and gallbladder, growth and sex hormones. It's utilized for fat burning, healthy cholesterol levels, proper stomach acid. And every single cell in your body has a thyroid receptor. That is why when the thyroid is not functioning properly, it can affect so many areas of the body. Proper function of the thyroid gland is paramount to health. They have discovered the thyroid gland communicates with the immune system, the gut, the brain, and endocrine system, and one will affect the other. So let's talk about how it works. I'm going to go into a little bit about the physiology because I think then you'll understand how and when and where it can break down and maybe possible ways to support you. It all begins in the brain. The hypothalamus releases a hormone, thyrotrophic releasing hormone, to the pituitary gland. The pituitary gland then releases the thyroid stimulating hormone. This is the hormone that is normally tested on a routine thyroid screening. The pituitary gland also regulates the release of other hormones such as ACTH to the adrenal glands, and this will be responsible for the release of cortisol, aldosterone, progesterone, DHEA, epinephrine, norepinephrine. The pituitary gland will also release luteinizing hormone and follicle stimulating hormone, which are responsible for the menstrual cycle and the production of testosterone. For the purpose of this webinar, we're going to concentrate on the thyroid gland only. So to make thyroid gland, once the thyroid receives the TSH, the thyroid gland needs iodine and tyrosine. So T4 is 4 molecules of iodine and 1 of tyrosine, and T3 is 3 molecules of iodine and 1 of tyrosine. The thyroid produces 97% T4 and 3% T3. To transport the molecules, they hop on a taxicab, which is a protein. It's called thyroid binding globulin. And this taxicab transports it to the liver, where then T4 is converted to T3. So 60% of T4 is converted to T3 in the liver, 20% in the gut, and 20% in the peripheral tissues. Now, selenium is extremely important for the conversion of T4 to T3. We also need a healthy gut, pituitary, liver, adrenals, iron, iodine, selenium, zinc, magnesium, tyrosine to make this all happen. Once it converts it to a more usable form, T3, it again hops on a protein globulin, and it transports it to the receptor site of the cell. Once it gets to the cell is dependent for the absorption for methyl groups, and it needs zinc and iron as a receptor. So again, just to look at the overall picture, the pituitary gland regulates all the hormone regulation, and then you need a proper functioning gut, liver, certain enzymes, minerals to have this function properly, and then good methyl groups, which can be a genetic issue that we'll talk about in a little bit. So a standard thyroid test is to just measure TSH. But we just kind of found out that there's a lot more to just regulating TSH. There are other tests that we think are extremely important. We like to run a complete thyroid panel. The total T4, which is your thyroxine. The free thyroxine index, which is the amount of T4 that's available. Free T4. T3 uptake, which is the amount of T3 that is taken up by the thyroid binding globulin, the taxicab. Free T3, which is your active thyroid hormone, which actually goes to the cell. Reverse T3, which is kind of a sign of an inflammatory process in the body. We also like to measure the antibodies, TPO and TPG, which can tell us does the patient have more of an autoimmune thyroid, which is called Hashimoto's, and the TSH antibodies, which tells us does the patient have Graves' disease. And the last test we like to run is the thyroid binding globulin levels to see if it has enough protein to take the thyroid hormone to where it needs to go. So the current model of thyroid management was developed in 1960 and has not been changed since. TSH and total T4 are all that is measured. How can you manage or support the thyroid gland or any condition without the entire picture? It is important to address the causes: liver, gut, methylation, genetics, toxicity. As I mentioned, the number one cause of primary hypothyroidism is Hashimoto's. The test is the TPO and TBG antibodies. It is an immune problem and must be managed as such. Why your doctor has never run the test to determine if you have Hashimoto's is the treatment for this condition, regardless of the cause, is always the same. It's hormone replacement therapy, even though the problem is the imbalance within the immune system. So what triggers the immune system to do this? Well, first, it is dysregulation. The immune system is out of balance due to stressors on it, and the stressors could be poor diet, blood sugar imbalances, adrenal gland dysfunction, hormonal issues, neurological imbalances, pregnancy, low vitamin D. And the second type of trigger is when the immune system is imbalanced due to an invader or antigen, such as infections, viral, bacterial, mold, gut infections like candida, parasites. There could be food sensitivities, environmental toxins such as herbicides, pesticides, glyphosate like Roundup, leaky gut syndrome, heavy metal toxicity, more specifically mercury and copper. Proper testing is necessary to identify the cause. How do we manage and support Hashimoto's? Well, you must remove the antigen or cause. Second, we need to modulate the immune system through nutrition and supplements. Emulsified vitamin D, fish oils, glutathione, nitric balance all help decrease the inflammatory response. The immune system is either Th1 or Th2 dominant, We need to support the non-dominant side and restrict the dominant side so our immune system stays in balance. Thyroid problems are often not or misdiagnosed, primarily because we do not run enough lab markers and the lab ranges are too wide. We will discuss this more when we talk about functional medicine lab interpretation. So what are the 6 major thyroid patterns that we need to look and identify? Well, there's primary hypothyroidism. There's hypothyroidism secondary to a pituitary gland issue. There's thyroid underconversion, overconversion. You can have thyroid binding globulin elevation from contraceptive use or hormone replacement therapy. And there can be thyroid resistance at the cell receptor site. So primary hypothyroidism is where the thyroid gland gets lazy and begins to pump more TSH to produce more thyroid hormone. This is the only pattern that can be fixed with hormone replacement therapy. Nutritional therapy, if caught early enough, is porcine thyroid gland, ashwagandha, vitamin A, D, selenium, and zinc. The second pattern, which is hypothyroidism secondary to pituitary hypofunction, is a low TSH and normal T4 on labs. This can be due to chronic stress, which fatigues the gland, fluctuating insulin glucose levels. The nutritional support is porcine thyroid and pituitary gland, sage leaf extract, L-arginine, magnesium, zinc, and manganese. The third pattern, which is thyroid underconversion, is the gland is not making enough T4. It is making enough T4, but there is not enough conversion of T4 to T3, which occurs in the liver. This primarily is due to chronic adrenal stress. And the solution is nutritionally glutathione cream, phosphatidylserine cream to support the adrenal glands, and then there's certain compounds to help support the conversion of T4 to T3 like selenium and zinc. The fourth pattern is thyroid overconversion at decreased thyroid binding globulin. Too much active T3 is made and it's overwhelming the cells, or too little thyroid binding globulin, which means too much free T3. And the main reason for this is insulin resistance. So what we need to do is stabilize the blood sugar levels and the adrenals. We like adrenal calm, adaptocrine, glycine, and protoglycine from Apex. The fifth pattern is thyroid binding globulin elevation, where there's just too much of these proteins in the blood and too little free T3. And this is primarily due to oral contraceptive use and estrogen replacement therapy. So nutritionally, we like to eliminate the extra estrogen by supporting the detoxification pathways in the liver. We suggest things like choline, beetroot, betaine HCl, milk thistle, dandelion root, ginseng, vitamin C, and phosphatidylcholine. The last pattern is thyroid resistance. The thyroid and pituitary are fine, but the hormone is just not getting to the cells. And there are a lot of reasons for this. It could be chronic stress, where it makes the cells resistant. The cells are dependent on methyl groups. So if we're having a problem with a methyl issue or undermethylation, this could affect it. So in this situation, we need to support methyl groups and address the adrenal glands. So again, adrenal calm, adaptocrine, and then we recommend aerobic exercise. So as you can see, proper testing is crucial to identify the underlying cause of thyroid dysfunction. Tests that we run include the complete metabolic panel, which includes the thyroid panel, including the antibodies. We need to analyze the liver and adrenal function, vitamin D levels, anemia, kidney function, hormone testing, salivary adrenal function to test cortisol, melatonin, DHEA. We like to utilize Cyrex labs to determine are we food sensitive or have leaky gut issues, and then stool testing to look for gut infections, parasites, or yeast infections. Some other testing that we recommend, depending on the clinical picture, is genetic testing through 23andMe to specifically look at the MTHFR gene. We can thoroughly analyze the methylation cycle by running this test. The thyroid hormone is dependent on methyl groups to get into the cells. We also like to look at detoxification pathways and specifically the gene for thyroid. At times we'll order a hair analysis test from doctor data or analytical research group to analyze toxicity levels of mercury, copper, and to look at essential nutrients like magnesium, manganese, and zinc. Functional medicine's main premise is to discover and identify the exact cause of the dysfunction. Based on lab findings and clinical examination, nutritional products are dispensed to support the biochemical pathways for healing. We address the gut, the adrenals, the thyroid, the liver, blood sugar, and autoimmunity. In summary, natural solutions for thyroid support include heal the gut, liver, adrenals. Kelp has iodine. Synthetic iodine is not good as it adds fuel to the fire of the autoimmune Hashimoto's. Vitamin D is good because it helps regulate the immune system and helps bind hormone to the cell. Selenium is important for the conversion of T4 to T3. Certain supplements such as calcium, magnesium, manganese, and iron. And we've discussed the importance of methyl groups and to analyze the MTHFR gene, as there's been a lot of research on MTHFR and Hashimoto's disease. Thank you for listening. And if you have any questions, you can email me at dr.veselak@gmail.com or go to our website, drmichaelveselak.com. Our Facebook page is Camarillo Functional Health. Thank you so much.